Hello everyone and welcome to the executive team Q&A. Today we've got John Brewin, Clare Teeney and Anne-Maria. I don't think I've missed anyone off. And I'm Yolanda Martin, I'm Associate Director of Communications, and I'll be batting the questions over to the execs. So as always, if you've got any questions, please put them in the comments and we'll endeavour to get to them. And meanwhile, I'll hand over to you, John. Thank you very much.
Hi, thanks, Yolanda. Afternoon, everybody. Welcome to Exec Briefing Q&A session for this week. You're very welcome. I hope everyone's managing the challenges. And sorry, I'm fiddling around a bit. Just sort of sat down. Press that. So as usual, I'll do sort of an update overview of how we're doing, what the issues are of the day, and then I'm going to hand over to Anne-Maria, who's just going to give a bit more detail around some of breaking outbreak news, and then we'll go on to the Q&A. So one of the things that we do fairly regularly is have a question and answer session with the governors, which myself and the chair did yesterday. And one of the questions that got asked there was sort of reflections on how we're managing COVID-19 within the organisation compared to in our sort of personal and social lives. And I thought it was a really good question. And that's sort of informed my sort of headline briefing today, really, because there's a stark contrast, and I think it's becoming more divergent that as we get more and more freedoms and reductions in the rules and regulations around COVID external to the NHS, within it, we're still very much at sort of pandemic levels of things that we've got to manage. And I think increasingly that's going to become quite a challenge for us to manage, and quite frustrating, understandably frustrating for us all. So on the one hand, when you're out of work, you can do A, B and C, but coming to work, there's a whole load of things that we have to continue to implement, monitor and report on. And these are all national instructions that are still coming down. We're no different from other mental health, learning disability, community and forensic trusts. We're no different from the acute trusts. So as challenging as that is, I think it's worth re-emphasising. So the first thing to re-emphasise is the vaccination, staff vaccination. We've still got just under 1,000 staff who haven't received a vaccination. There's still opportunity to receive vaccinations, appreciating it's still not mandatory. Though there are some important changes that we need to be aware of organisationally. For example, that NHS staff that are working into care homes as part of their job from November the 11th will require to be fully vaccinated unless they're in one of the exempt groups, which means that to enable that to happen, they need to have had their first vaccine by the 16th of September. And I think that's, I'm making the point about that because I think that's the first example of where we'll start to see some more compulsory measures around staff receiving the vaccine. We've still got lots of opportunity to receive it, where we've got lots of people with expertise around various concerns that people may have for very valid reasons. So continue to put that message out. The second point to emphasise is around the need to maintain social distancing, appropriate use of PPE, that has not changed. And the third bit is around lateral flow testing. And the issue around lateral flow testing is that it's really important that staff have 2 lateral flow tests a week, and that as well as having done them, that they report their lateral flow status. We appreciate that for the future, staff are going to have to access their own lateral flow supplies. We are aware that the reporting can be challenging, and we're working internally to make that as straightforward as it possibly can. Again, we're not in any different boat to anywhere else. But it's really, really important that we need to know, for example, on our wards, in our teams, that people are complying, and we need to be able to report the numbers, and we need to be able to, and we will be held to account, and regulators are really keeping a very close eye on that. And where we have started to have outbreaks, more from Anne-Maria in a minute, it becomes very clear that currently we're not doing that, and that both a percentage of staff doing lateral flows and reporting the results is low, and it's something organisationally we have to address, because we lay ourselves open that we are therefore not doing everything within our powers to make sure that we keep service users and patients safe. We have both staff and patients that have become COVID positive. And again, I make no apology, it's a bit of a bleak headline message, but this is the environment we're in. Appreciate everybody is working their socks off. People are tired and exhausted from having to work in with this in dominating their daily work lives, but it is the situation we're in. We can't see that it's going to change dramatically anytime soon. The case numbers look like they're plateauing out, don't they? And the people being admitted to hospital is gradually reducing, but this is going to be with us for a good few months yet. So I can't emphasize enough, please pass on the message to your colleagues, your peers, your team leads, because this is a really important part of the work that the trust has got to do. That's probably as much as I want to say on that specifically. I'm going to hand over though to Anne-Maria, who's just going to give us a bit more detail about the outbreak stuff, because again, that's a really important headline too. Thanks, Anne-Maria.
Thank you, John. So I'm going to start with one headline, which was from last week, which was a regional call I was on. So in the region, of all the intensive care beds in the intensive care units, 35% are related to COVID, and they are under 64 years of age. 35% of the patients in intensive care units are related to COVID, and they are under 64 years of age. I think that's really stark. Anyway, so I was a bit taken aback by that number. And initially I thought last year was bad and the beginning of this year was bad. We had, at the height of our season, January, February, had 15 outbreaks at any one point. And to manage 15 outbreaks is some going. And I felt when it went down in kind of like April, May, I was really relieved. I was thinking April, May, this is really good. We're doing something right. Our IPC practices are good. We're wearing PPE as we should be wearing, 2 meters distancing. We started the ventilation. Remember, I started asking you to open all your windows, etc., etc. And then in the last couple of weeks, Oh my goodness me, if I'd have ever said anything, I wish I hadn't said anything. I've now declared 3 outbreaks in the last 2 weeks. The last one was on Monday, just gone, 2 days ago. So those 3 outbreaks are really, really concerning. I can't deny it, really concerning. The first one, 5 patients and 5 staff. That first outbreak was really challenging, particularly because staff weren't doing lateral flow testing, and therefore we did not pick up the asymptomatic staff. Also, 3 of those staff ended up in hospital very, very, very poorly. And also we know that we've got somebody with long-term complications, rather. We also know that staff were unvaccinated in that outbreak. So the staff that were poorly, 3 of them ended up in hospital, were unvaccinated. And we also know that, like I said, very, very low lateral flow testing. So very difficult to pick up the outbreak before it spread to 5 patients and 5 staff. The second outbreak, again, a very difficult one to manage. A patient who was spitting, which is a really difficult situation, but several nurses found to be wearing their masks under their chin and observed to be under their chin whilst he was spitting. And the third outbreak, which I've just declared, again, really, really uncomfortable because I had NHSI on the call because they attend the outbreak meetings. And I cannot tell you how uncomfortable that was to hear that staff were observed not to be wearing their mask. 0% compliance with wearing the mask, 0%. And it gets worse, the screening of patients. So what I mean by screening, this is really, really important. In this trust, and this is nationally, we are required to screen all patients that are admitted on day 1, on day 3, and on day 7. And that's a PCR test, okay? And that really protects us from spreading it further to other patients. So they're meant to be isolated in the first instance, and then we do their tests 1, 3, and 7. Post 7 days, you can pretty much guarantee that they are clear. If they get it after 7 days, then it's called a nosocomial infection. And that means that they have contracted it whilst in our care. So days 1, 3, and 7. Again, that has not been done. So in our latest outbreak, we haven't been doing the screening on patients. So the patient has been able to spread it then to other patients, and there are now 3 patients affected in that outbreak. So I can't emphasize enough the importance of lateral flow testing, as John has said. Vaccinations are definitely helping. It's definitely helping in some of these outbreaks, because what we're seeing is the patients that are coming in who are positive are unvaccinated for one reason or another. And also the staff that are being affected are unvaccinated or have only had their first vaccine. I must emphasise that, because we've got some staff that have had their first vaccine and not their second. Masks, really, really important. I know you don't have to use them outside of healthcare. Well, you do need to in dental and in certain areas, but honestly, we have got to carry on wearing our masks and wear them properly, because if you don't wear them properly, you might as well not wear them at all. But they are there to protect both you and the patient. The other thing is level 2 IPC training. It is so low in this trust. One of the outbreaks, only 50% of the staff have done that. So IPC level 2 training, that's really important for you to understand what is needed in any outbreak situation. The other thing that NHSI picked up on in this trust, we have a tendency to wear false nails. So this is a bit of a plea, bare below the elbows, false nails. So again, they've observed people wearing cardigans, dangling bracelets, all sorts of things. If you are in a healthcare setting, which this trust is a healthcare setting, then please, 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 bare below the elbows. And please, please, no false nails, and particularly bright coloured false nails, because honestly, I don't know how I can You know, NHSI make it very, very difficult for me when I have to answer to why people are wearing these sort of things and doing these sort of behaviours in this trust. So that is my plea. The outbreaks seem to be coming back up. Now, whilst I'm only saying we've got 3 outbreaks, we've actually got 25 positive staff. Okay, so we've got 25 positive staff, but they're all odd cases where they've picked it up in the community or from a home or from schools or whatever it is. Or I always say to people, it's Tesco's tins of beans. That's how I equate it. You've either caught it from Tesco's in a tin of beans, or you've caught it at work because you've had your mask down. That's the best way to describe it for me, anyway. So it is on the rise, and it is definitely spreading amongst the population that have are either unvaccinated or not taking precautions with regards to masks. So that's my, I know I'm on the soapbox. I'm so sorry. But honestly, if you were in those meetings, and I know that all the staff that were in those meetings in the last couple of days would vouch for how uncomfortable it is. We just don't want to go there again. We don't want these outbreaks. Our patients are vulnerable. Please, please, please take care of them.
Okay, Anne-Maria, thank you for that. There is a question that's come in on the back of what you've been talking about there. So Catherine's put in the chat, we are going to start returning to the office soon, initially 1 at a time. Can they just clarify, as an admin office, do they still need to follow exactly the same PPE testing and IPC guidelines as clinical staff?
So I suppose my question would be, if you're saying that it's just an admin office, we still need to do the 2 meters distancing, we still need to wear the masks, and we still need to do the ventilation. That is absolutely paramount. It doesn't matter what kind of office you're sat in. Okay, we do the same at headquarters. You know, we haven't got any patients in headquarters, but we do exactly the same. We apply all 3 of those to anything we do in our offices here. Yeah, so I suppose the best answer is yes, absolutely, we have got to do that, and that's good practice, safe practice to try and start bringing people back in 1 at a time. I've had some horrendous outbreaks in offices that were pure admin offices. The last thing you want to do is spread it amongst yourselves and take it home to your families, your friends, and your loved ones.
Thank you, Anne-Maria, for that. We've had some questions submitted in advance of the meeting, and John, the first question is for you, but it's quite a long question and quite detailed. So if I could just leave it to you to sort of précis that and then answer it, that'd be great, please. Thank you.
Thank you. What, do both? Right.
Absolutely. Well, yeah, definitely don't give me the question to answer, John.
Right. So, and I'm going to summarise this because it's quite lengthy, but essentially it's a question that poses a theory that this person's experience on a ward from April of last year until only recently, they had no outbreaks of COVID in either patients or staff. And then in recent times where there has been an outbreak, this has been after patients and staff have been vaccinated, and therefore asking the question, is the trust looking into the possibility that the vaccinations have facilitated new variants, and that's the reason that they're now getting outbreaks? And then there's more detailed issues which we won't go into today. My simple response to that is that that's wrong, and quite dangerously wrong, really. The single most important thing people can do to reduce the risk of both catching COVID and transmitting it is to become fully vaccinated. No one's making claims that it stops infection, but they clearly reduce the severity, and no one's making claims that it stops transmission, but there is good evidence that it reduces transmission. And the view that having the vaccine actually causes our staff and patients to become susceptible to contracting coronavirus is wrong. And we're very clear that actually, and Anne-Maria will have the numbers before we had access to vaccinations, the number of outbreaks were significantly higher than we have now, and people will be getting it now for different reasons, but it is so important to reiterate the fact that we need to make sure as many staff get vaccinated as possible, and that we keep, as we're saying, we keep making sure that we abide by the rules in terms of social distancing, etc. Yolanda, that's probably as much as I want to say in response to that particularly. Like I say, there's lots of other detail, but I don't think that's relevant to this sort of meeting. Thanks.
Thank you, John. And what you've been saying was absolutely what the Public Health Director for Nottinghamshire was saying on Radio Nottingham this morning. So he was interviewed at length about that, and he said it exactly the same as you. So if you'd like to just stay in the hot seat, John, the next question I think is for you, and is about, is the trust strategy being updated?
I'd switched myself off prematurely. In brief, yes, it is being updated. We've deliberately profiled COVID conversation today in the headlines, but you'll all be aware as well that there's an awful lot of business as usual work going on, not just behind the scenes, but right across the organisation. There's all the usual reporting, both internally and externally. We had a good board meeting the other week. We've met the governors, etc., and updating, refreshing the new trust strategy is work that's in progress. It will be the 22-27 5-year strategy that will be informed quite significantly by the events of the last 18 months, and to really make sure that we take the learning from things that have gone well and things that have gone less well to take us forward. There's a lot of work going on in terms of making sure that at the heart of this are our usual principles around patients and service users being at the centre of what we're aiming to do. A sharper focus on making sure that we continue to improve the quality of services and outcomes for people. And over the coming months, there'll be several ways that staff will be able to get involved in the more deep in that strategy development and evolution. And we've got a focused conversation, for example, on connecting knots on the 19th of August, again, which is an open forum for people to listen into some more detail of that presentation. I note that our Director of Nursing got her hand up. Anne-Maria.
Thank you, Chief Executive. So I've added in the right-hand side the 7-minute briefing on the development of the strategy. The reason I've done that is I didn't know whether or not people knew about the 7-minute briefings. They're absolutely brilliant, and we've got loads and loads of them on all subject matters like Mental Capacity Act or restricted practice, blanket restrictions, MCA. So there's lots and lots of these 7-minute briefings, but this one's been developed by the team, the team that are developing the strategy. And rightly said, like Catherine Conscious said, we're out for discussion and consultation, but that strategy is a really kind of like on a page, and it's really quick and easy to be able to see. The CQC do tend to ask senior staff across the organisation, what is the trust's strategy? So that is a question that the CQC like to ask, and it doesn't need to be complicated. It is about the fact that, we're working on something, and they could easily just look at that and just say, this is the main areas, these are the priorities, and we're out to consultation. We've had a strategy and we're now updating it. That's all we need to do. We don't need to make it complicated. So just to help people on the right-hand side there.
Thank you for that, Anne-Maria. Claire, please would you turn your camera on so that I know you are here and paying attention. Fantastic, thank you. So Claire, we've got a 2 or 3 questions now about HR sort of type questions and also about the pay rise. So if you would answer the first question, which is, what is the Refer a Friend scheme? They've seen about it on social media, on the Trust social media, and they're just wondering what it is and how they can access that, please, Claire.
Thanks, Yolanda. Afternoon, everybody. I'm Clare Teeney. I'm Director of People and Culture here for people that I've not met. And Yolanda, I wouldn't dare not pay attention. So the questions around our kind of people, and with one related to the Refer a Friend scheme. This is something that we introduced a while ago, actually, and it was to try and support some recruitment initiatives, particularly for Band 5 and Band 6 clinical colleagues, because that's where we've got areas where we've got particular staff shortages. So the scheme is still live and is still relevant. So if you know people who are interested in working in jobs for us at Bands 5 and 6 across the 3 operational divisions, so community services, forensic services and local mental health services, and you introduce them to the organisation, then you can receive £500 as a consequence of doing so. There are a couple of conditions, so you can't refer people that are already working for us, but generally it's pretty flexible in terms of how it works. So please encourage your friends and family to come and work for us where they can. You can find out the details on Connect under the Refer a Friend scheme. And if people have got any other really good ideas or examples of other things that are going on that we could do to encourage recruitment into the organisation, then please get in touch. I'd be really interested in hearing about those and seeing what else we can introduce here. Thanks, Yolanda.
Thanks, Claire. If you'd like to stay there. The next question is about appraisals, and somebody is asking what they need to do if their appraisal is out of date.
Yeah, and I will just stay. So I'm now paying attention and I'm staying put. I'm just wondering what other instructions are going to come my way. As you can see, everybody watching and listening, we are really well disciplined and organised here as a consequence of our Director of Comms. She does a great job. So appraisals are really important. It's really important that you get the opportunity to have that conversation with your manager. Now, during the last 18 months, we accept that lots of people redeployed into different jobs. And we actually said that appraisals wasn't one of the priorities in the height of the pandemic, when we were focused on prioritising some of that clinical operational service delivery and support services to enable that. However, it's really important that you don't let that appraisal conversation lapse too much, because it's the right thing to do. It's important you get it. It's important that you can raise the things you want to and that you get feedback and have that one-to-one time. So if you are due for your appraisal or haven't had one for some time, talk to your manager about it. We've got all the guidance on Connect under the annual review section. And for people, what I always say as well, whilst we do appraisals once a year, you know, people work in lots and lots of different ways and have different connections with the people that they work with and their managers. So you don't have to wait for the year to have your appraisal. If it's really timely that you have that conversation, then please prompt that discussion and get that underway. And if there's any other questions or things that people want to raise on that, please put them in the chat or drop us a line. Thanks, Yolanda. Is there any more for me?
Just one more question for you, Claire, at the moment, but I have put a plug in the chat to say, ask us any more questions. So the final one for you, Claire, before we hand back to John, or we might have some more additional questions, is, will all staff get the 3% pay rise that we've been talking about, or is it just nurses?
Yeah, thanks for that. Thanks for that, Yolanda. So that basically, it's not just for nurses. The 3% pay rise applies to everybody covered by Agenda for Change terms and conditions and medical and dental staff. There will be a small proportion of NHS staff that aren't eligible because they're covered by previous pay awards, but that is a really small number of people, and we will be making sure that if you're not eligible, you are contacted. In the majority, if you're covered under those national terms and conditions, you will get it. It will be backdated to April, and it will go into the September pay.
Thank you, Claire. Just don't step out of the microphone range just yet. Catherine Concha has put in a shameless plug, absolutely shameless plug for the Extravaganza, the virtual Pride Extravaganza, which took place yesterday and was a very noisy and buoyant affair. So she's just asking if you would like to share what was your favourite bit of the Extravaganza, Claire, and then you are definitely off the hook for a while.
Oh, that's all right. So I'm staying put, I'm paying attention, I'm not moving away from the microphone. Now, I can't remember more than 3 things at any one time. So that's good stuff. So yeah, really good virtual Pride event yesterday. Really enjoyed it. I was in the office on my own, singing, dancing and laughing, and also was paying attention actually, because there were some really serious points of communication that came through that event. Really well organised. Thanks to everybody that took part and all the people supporting making it happen. Couple of highlights for me. There was some really powerful pieces of poetry that were read. Really moving. Completely grabbed your attention, and I thought that was really powerful in terms of communicating some really personal messages. That was fantastic. Equally, it was joyous. There were colleagues that put themselves forward to do some singing, which I think is really brave, and thank you to them to do that. So I enjoyed the singing and dancing and laughing, and particularly some of the set pieces that people did. There were a couple of dance renditions to the Time Warp, which is something that particularly stays in my mind in terms of yesterday's session. I'd encourage people to have a look. But yeah, the poetry, the singing and the dancing, and just generally serious messages, but a bit of the joy that goes with Pride. I think it was really, that was the piece that I enjoyed. It really did lift me, despite some of the serious and hard hitting messages that came through. So thanks to everyone involved.
And in answer to Catherine's question about did everybody do the Time Warp, I think everybody did the Time Warp. So thank you for that. John, we haven't got any more questions. I think somebody's put something in the chat about how do they get a 7-minute briefing produced on something, and Anne-Marie has responded to that to say contact Louise Dobson. And then over to you, John, to close for us, please.
Yeah, thank you. Just on that question from Lynn on 7 minutes, good idea actually. The ones we've put together, as Anne-Marie said, were around the quality first stuff, but I suspect, Lynn, and you might be thinking around sustainability, but there may be a lot of people on the call and listen to this thinking, oh, I could do a 7-minute briefing on the bit that I'm, really passionate about. And I think that could be something that would be a really useful resource, couldn't it, in terms of spreading some of the high-level content of what this huge organisation does. We often say we're very, we're broad based, we're very diverse, and there's lots of parts of the organisation that don't know what other parts of the organisation do. And well put together 7-minute piece of stuff would be a really good addition to the things that we do to sort of spread the love. So I think that's a good call, Lynn. Yeah, back to sort of summary. It's interesting, isn't it, the contrast, that the joy that Claire's talking about within the harder hitting messages from a Pride perspective. but I do appreciate that some of the messages, the headline messages today, have been a bit grim, and that it's really important to acknowledge, the work that people are doing, but by the same token, we can't get away from some of that in a minute. But wanted to sort of just draw things to a close by just thanking everybody for their continued hard work and perseverance in which are really tough times. That I know I say this on a weekly basis, that these are the busiest weeks that the NHS is experiencing. It's busier than the middle of winter traditionally. It's not just across mental health and disability community, it's primary care, it's social care, etc. If there are things that you think that we can do in addition to help support the burden that teams are managing, let us know. For example, today in the exec team, we talked about putting an extra layer of administrative support in to support some of the managing all the testing and reporting, and we do try to sort of keep on top of that, because again, the appreciation is there that this is all in addition to the day job, if you like. Yes, thanks, Yolanda. I just wanted to end with a thank you to everyone for what they're doing, for putting their attention to the last half hour or so. Really good conversation, and we'll look forward to meeting up again in a couple of weeks' time. I've just noticed another thing in the chat there from Andrew. Was that a question or?
No, it's not a question, John. It's just giving an update. That's all for Unison members.
Lovely, thank you. There you go, Yolanda. I think we're all done.
Great stuff. Thanks a lot, John. Thanks everyone for joining in.
Thanks, everybody. Have a good afternoon, and see you soon.
Bye.